Welcome to Guns, Guns, Gear, and Guns with Gary Gunderson. I am Gary Gunderson. The Surgeon General released an advisory on gun violence in America, declaring it a public health crisis.
Good to see you, Doctor, this morning. This is very important news that you're breaking.
No, it's not.
Because we know gun violence has been a problem in this country for a very, very, very long time. So why now are you calling it a public health crisis?
Because it is an election year.
Well, the good news is that there is a lot we can do to address gun violence. And I know that many people look at this issue and they see that it's been polarized, that it's been politicized, and they worry that this is an intractable issue in America. But one of my goals here is to take this issue out of the realm of politics and put it into the realm of public health, which is where it belongs.
Except recommendations in the advisory read like a gun grabber's wet dream, calling for safe storage laws, including penalties if someone is injured, and storing ammunition separately from your firearm. Hope you don't have to defend your home in a hurry. It advises not just universal background checks, but increasing age restrictions for purchasing a firearm, requiring waiting periods, and attending safety courses before purchase. It calls for more robust red flag laws, an assault weapon ban, and magazine capacity restrictions. It suggests ending constitutional carry laws and stand your ground laws while expanding ineffective gun-free zones. And of course, it calls for allowing firearms manufacturers to be sued by victims of gun violence, saying they are not regulated for safety features, except that if your new firearm exploded in your hand due to a manufacturing defect, you could still sue. Seems like the realm of the political. They also want doctors and nurses to bring up the safe storage of firearms during routine medical appointments. It also finds that since people in poverty or marginalized communities are more likely to be a victim of gun violence, we need to invest in housing, provide equitable access to education, healthcare, and economic growth.
That has led to a collective trauma in our country, where now 6 out of 10 people are worried about losing a loved one to gun violence.
Yeah, you can be worried about gun violence because there are criminals and it does happen, but I am also worried about theft, car accidents, the boot of the government on my neck. Can we have an advisory on that? That's much more traumatic collectively.
Our children should not have to live in fear that they are going to get shot if they go to school. None of us should have to worry that going to the mall or a concert or a house of worship means putting our lives at risk.
There's a risk you will get isekai'd by a truck every time you step outside. There will always be dangers. The likelihood of being killed in a mass shooting, despite the publicity, is extremely low. So that's called a phobia, an irrational fear, and should be treated as such.
And gun violence has now become the leading cause of death among kids and teens. That was not true a decade ago or two decades ago, but it is true today.
Notice how they say children and teens. That's because it includes adults like 18 and 19-year-olds, or it wouldn't be the number one cause. Now, why would they do that?
And my hope is that if we understand this as a kids issue, that we will raise it on the priority list, that we will see it not as a political issue, but as a public health issue that should concern all of us.
And that's why they lie with this statistic. But of course, it also becomes a talking point for gun control advocates like the media.
Gun violence kills more children every year now than any other cause, surpassing car accidents. And
it's like you're not even paying attention. I just said that. I will note that at least CBS stuck with the children and teens to nab those little adults in their statistic, but MSNBC just omits it, making it an even bigger lie.
In 1964, when the Surgeon General issued a Surgeon General's report on tobacco for the first time, many people at that time said, you know what, this is just part of the fabric of America, smoking. Kids smoke, adults smoke, doctors smoked at that time, nearly half the country smoked.
Everyone brings up the 1964 advisory on smoking as a landmark moment, and it was, because people weren't really aware of the harmful effects of smoking as much as we know today. We know what guns do, and it's not the 60s. People don't just listen to the government like they used to. We know this is just a political ploy and not anything to do with reality. The advisory also goes into details in odd ways, like how about how the distribution of firearm deaths is not equally distributed among the population. Would it be better if it was? For mass shootings, they also reference the Gun Violence Archive, which notoriously has their own definition of mass shooting, which inflates their numbers.
So help me understand, once something's declared a public health crisis, besides just making sort of that symbolic statement, what else changes? Does it empower doctors or authorities in a new way?
The answer is nothing. Nothing changes.
Before he's confirmed to the office, he told reluctant Republicans he would not use his position to push gun control.
You mean he's a liar? Shocking.
Do you think guns present a public health emergency?
Well, Senator, I think that gun violence, like any other form of violence, is a concern to me as a doctor who's taken care of many patients who have been the victims of violence. But I think the way we approach that issue, Senator, should be driven by science. I'm grateful that Congress has, on a bipartisan basis, put funds to study the origins of gun violence and how best to address it. But I'll tell you that my focus, Senator, is not on this issue. It is, and if I'm confirmed, it will be on COVID, on mental health, and on substance use disorders. These are the issues which I think are front and center in this moment. It's where I would put my attention.
Liar!
But here's what I have learned over the years of talking to people in communities across America.
You see, people are chumps and will listen when an authority figure tells them something. These hard-hitting interviews sure do the media justice.
I know a lot of people for a long time have been wanting this to happen.
Because we know gun violence has been a problem in this country for a very, very, very long time.
But we also know that for every one person who loses their life, there are two who are injured.
He's right. I've been injured by firearms. I've gotten slide bite before, and I've burned myself with hot brass. We need to take to the streets and end firearms violence by outlawing everything he dislikes.
I'd love to be able to tell you we just take one step that we can solve all of gun violence, or that we had the luxury of taking an incremental step here, waiting 5 or 10 years and seeing what happens. We don't have that luxury.
Of course, because when it comes to freedom, you should err on the side of tyranny. We cannot take a reasoned approach and instead should infringe on fundamental rights in every way we can. After all,
you never want a serious crisis to go to waste. And what I mean by that, it's an opportunity to do things that you think you could not do before.
Makes it seem a little political and suspect. Anyways, that's all for today. If you have made it to the end of the video, check out my other content. I have lots of similar videos breaking down gun control types and talking points. Consider supporting me on Patreon, joining the Discord, and don't forget to like, comment, and subscribe to the channel. Thanks for watching.